a very obvious switch that I missed. Good afternoon. Thank you for coming here. I am Dr. YAGER. I am, as represented in the program, I'm a psychologist with an appointment as a clinical professor in the School of Medicine in San Diego, California, where I live and practice. Something in the order of 40 years ago, I began to wonder about this phenomena of mental functioning. I began to wonder how to explain what I was observing. How is it possible for an intelligent human being to behave in ways they really do not want to behave? Whether it was smoking or other compulsive behaviors or the irrationality of a phobia, on and on and on. Out of that, I came to several conclusions. And from those conclusions, there evolved this method that I named subliminal therapy. Now, this method is very unconventional. So unconventional that it has been known that I was considered too far off and should not be listened to. However, I have objective data to demonstrate the really remarkable effectiveness of this method. The method is psychodynamic. It assumes that present problems are the consequence of things in the past. Well, in applying this method, the patient will normally, very spontaneously, slip into what could be identified as a hypnotic trance. So, some people kind of classify this as a hypnotic method, but it does not resemble hypnotic methods as they are conventionally understood. This method is based on two assumptions. First, that we are conditioned creatures. We're the consequence of experiences that we have in life. Well, any reasonable person would agree that certainly we're conditioned by the things that happen to us, but I have found that that extent is unexpected, and the intensity of the consequence has not been fully recognized. Conditioning. Well, conditioning is kind of a learning, except that it occurs without conscious awareness that it's happening. If a dog attacks a little child, well, at that moment the child is going to learn to be afraid of dogs. Not just that dog, all dogs. The child is not aware that they're learning to be afraid of dogs. They're only aware of what's happening. Well, that kind of pattern, that phenomena of conditioning, is responsible for all manner of disorders that your patients are going to present to you. These disorders may be mental, they may be physical in consequence. Now, the upside of conditioning is that reconditioning is possible. We can learn in a different way from the same material. If a little child is lost in a department store, and the little child is afraid, there's just no, it's real. that a child's experience is real fear. But that child, now an adult, remembering that experience, can probably chuckle about it. It's a matter of perception. It's a matter of how we can learn things that is to be conditioned in different ways. Now, in applying this method, the clinician guides the process. Well, that's not new. The patient does the work. Well, that's a little bit new in that the clinician is remarkably uninvolved in the content of the work being done. Well, now that's kind of an off-the-wall statement. How can the clinician guide the process without knowing what the process is? Well, he has to have enough feedback to do it intelligently, as you will see. Nevertheless, in terms of the content, the memories, the understandings, the extrapolations, in terms of the content of the material that the patient is engaged in, the clinician is on the outside. Does not have to be aware of any of the content, actually. The characteristics of this method are these. The conscious mentation of the patient during the application of this method is that of an observer also, joining with the clinician in that sense. Because of this disassociation from the content of the work, clinician bias is held at a minimum. Now, in the end, the patient presents a problem. The clinician guides the patient to resolve that problem by reconditioning. And when the problem is resolved, the symptom, whether it is depression, anxiety, migraine, headache, whatever the problem may be, simply ceases to exist. That's the criteria of success in using this method. Very successful. This method is very successful. Addiction, that's chemical and social. 90%, over 90% success rate. And the other numbers are just as unbelievable. And that's the word I hear. This can't be true. Well, it is true. These numbers I don't have controlled research that will satisfy most anybody. What I do have is data collected from inventories completed by my patients before treatment, after treatment, and where possible, a follow-up. This inventory that I use is one page. Patients can complete it in very quickly. They don't have a problem at all doing this. I even use it along the way sometimes to monitor progress. The point is that this is not just my opinion. This is based on objective data derived by patient input. Now, on Thursday, I will begin a essentially two-day training in this method as a part of this conference. If you're interested in more deep involvement, I hope to see you there. But now I want to talk about this method a little more freely, a little more specifically, and give you hopefully some way to relate to this. I understand our mental functioning. This is where I came to 40 years ago. That our mental functioning is part conscious, then there is a subconscious domain, and then there is a domain of intelligence that is vastly superior to our conscious capability. Well, again, I will be pushing the limits for some of you. You may have discounted me already when I said that. But, you know, I see evidence of this level of intelligence in many ways. Of course, in little ways like hunches and insights. But if you stop to think about the level of sophistication of the control system that keeps us alive, it boggles the imagination. I don't think we can even comprehend it consciously. To regulate all of the vital functions in response to the environment, that's a high level of intelligence. Well, if we have such a level of intelligence, it would make very good sense to tap into that to solve some problems. Well, that's what this method is all about. In application, the work of therapy is accomplished by that higher level of intelligence that the patient has. The patient has a role, but it's a minor role. And basically, the patient is just as much of an observer as the clinician. Of course, the clinician has to have enough information to be an intelligent guide. Well, that means the clinician must be able to communicate with that higher level of intelligence, which, incidentally, for convenience, I named, and the name I assigned is centrum. Centrum is a German word. It means the center, the core. So in interacting with my patients, I direct questions and requests to the patient's centrum. Well, their centrum hears me. That's not a problem, but I can't hear their centrum. And that's where the role of the patient comes in, to fill in that communication gap. I pose questions, requests. The patient speaks the response that the patient receives from their centrum. They're taught how to do that. And it's no big mystery. We can do it in many ways, actually. Turns out the most convenient, pragmatic way is to ask the patient to create an image of a chalkboard in their mind's eye, and then to report to me what their centrum writes. Well, you see, their centrum has abilities to access memories. It seems possible that at that level of intelligence, all memories are available. I can't defend that, but I think maybe it's true. Centrum has the ability to communicate in ways the patient can't consciously communicate. So, in essence, then, every person has this higher level of intelligence that can be tapped into to do some wonderful things. So now back to the subconscious. Remember, there's consciousness, subconscious domain, and then this extra conscious domain that I named central. The subconscious domain seems very accurately analogous to the memory of a computer. If we create a program to control a piece of machinery, and we put that file in the memory of the computer, that computer can control that piece of machinery exactly the same way, time after time after time. Nothing changes unless we pull it out and change it. Now, human functioning seems very like that. If some event, the more traumatic, the more intense, if some experience happens to us, it seems that a part of our mind, literally, is created. You know, if you learn a new skill, something is there now that wasn't there before. Whatever that something is, it's what I refer to as a part of that person's mind. That part represents the ongoing influence from the event. That part is that program that was created in that situation. When the dog bit the little kid, a part of that child's mind was created. And that part, I don't know whether it's represented neurochemically, psychically, I don't know. I just know it's there. And that part of the mind will keep that child afraid of dogs unless and until some kind of reconditioning can occur. Hopefully, other experiences with other dogs, the child comes to recognize that was only that dog, not every dog. I don't have to be afraid of every